Good afternoon and welcome. My name is Monica Wedlock Kilpatrick, and I serve as the Director of Connect Ministries for the National Benevolent Association of the Christian Church Disciples of Christ. As we get started, I want to inform you that this webinar is being recorded and will be available for future viewing on the NBA website at nbacares.org. This webinar continues our 2017 series of webinars and educational trainings offered by the NBA Mental Health and Congregational Care Initiative. And today's topic is Becoming a Welcoming Church, Creating Safe Boundaries for Congregations Serving Those with Severe Mental Health Issues. As clergy and congregation leaders, we so often strive to create a safe space for all who come through the doors of our church. However, knowing how to create an atmosphere of safety that is welcoming of people with severe mental illness can often seem like a daunting task. This webinar will explore some of the misconceptions about serving people with severe mental illness, discuss the realities of safety that come along with such a task, and highlight ways clergy, religious leaders, and congregations can incorporate the proper assessments, boundaries, and practices necessary to ensure their place of worship is truly welcoming and safe for all. For today's webinar, we will not take live questions in an effort to give the panel as much time as possible on our topic. Though throughout the webinar, if you have questions that emerge, we welcome you to use the Q&A feature by clicking on the icon at the bottom of the screen to submit questions for later response by our panelists. Please include your email address so that we can respond to you directly. And to request technical assistance, you may also use the Q&A feature. If you are participating by phone, you may email me at mkilpatrick@nbacares.org. Again, that's mkilpatrick@nbacares.org. Again, live questions will not be addressed in this live setting, but in a follow-up communication. So let us begin by introducing our speakers. Angela Whitenhill serves as our mental health initiative coordinator for a mental health manager for the National Benevolent Association. She's an innovative family and children's therapist, as well as a licensed minister with experience in the mental health field and higher education, with proven success in interdisciplinary program development, bridge building, and organizational leadership. As a licensed clinical social worker, Angela specializes in trauma, suicide, depression, identity issues, and spirituality integrated psychotherapy. She formerly served as chaplain and therapist at the Tennyson Center for Children, an MBA DHM Health and Social Service Ministry partner, and one of the Rocky Mountain region's leading residential treatment centers. There, she helped create one of the nation's few spiritually integrated residential treatment programs. She has also led and facilitated multiple training workshops on therapeutic intervention and cultural competence within the social work field. We also have with us Reverend Judy Johnson, who is an associate minister at the United Church of Christ of St. Augustine. Judy is an ordained minister within the Disciples of Christ with partner standing in the UCC. She's a member of the Mental Health Network Board of Directors and chairperson of the Florida Conference of Mental Health Ministry team. And she's also a licensed clinical social worker in Florida and New York. Judy serves as an instructor for mental health first aid. Dr. Terry Crump, PhD, is a licensed clinical psychologist, board certified clinical hypnotherapist, and owner of Crump Wellness Services here in Georgia. She has served as an adjunct professor, training graduate students in abnormal psychology and human growth and development. In addition to co-authoring a self-help book entitled Faith, Finding Answers in the Heart, Volume 2, Dr. Crump has been a guest blogger for Conscious Life Journal and for the National Benevolent Association. And Heather Honeycutt is a member of First Christian Church in Marietta, Georgia. She's a student at Phillips Theological Seminary and under the care for ordination with the Christian Church Disciples of Christ in Georgia. Heather holds a master's degree in professional counseling and is a licensed associate professional counselor. Heather specializes in trauma therapy, working in private practice, and in the cities of Marietta and Ringgold, Georgia. At this time, I'm delighted to welcome each of our panelists and our moderator, and I'll turn the conversation over to them.
Thank you.
Thank you.
We'll get started today. just by thinking about how do we become a welcoming church. This is something we're going to continue to talk about. And our topic today actually came from multiple questions of concern and just thoughts from church leaders on how to balance maintaining safe boundaries, but being welcome as well. So today we're going to talk about situations of severe presentations of mental illness to really ease some of the tension that leaders might be facing. But we would be remiss if we did not address the stigmas that also exist around the topic. And so as a church, what we've seen is that we really do have a pretty fixed idea of what severe mental illness is. And unfortunately, that's usually associated with danger and even spiritual danger at times. And so when we hear the word severe mental illness or mental illness, we immediately think of these people as dangerous. And we just want to start by saying that that simply is just not true. Mental illness, like everything else, exists on a continuum. And today we're going to focus on these presentations that might seem a little bit more scary or severe with the goal of making them less frightening by normalizing these behaviors and talking about what it might be. The vast majority of people with mental illness or severe mental illness, however, are really living fulfilling lives and are active in our churches and our communities without incident. They're me, they're you, they're our pastors, they're our choir directors. And though the media and social stigmas tend to perpetuate the idea that we always kind of question if somebody has mental health issues, if there's a bad behavior happening, or on the news, if you see the latest act of violence, we ask, was it mental health? We want to start by saying we hope that we really resist that stereotype, and we know that it's really important that we counter it. So we felt the need to start off our conversation today giving voice to those of us with severe mental health challenges and just allowing their voice in the matter. I was able to poll about 20 different people from our mental health affinity group, and these are active leaders across the life of the church, creating awareness about mental health and breaking stigma. And those who actually had mental illness or severe mental illness responded. And so I'm going to read their words verbatim. All the wisdom you're about to hear is not me at all. It's all different people. And so one thing I want to say before we get started is that you will hear a diverse set of responses with the voices from the pews, the people who have mental illness, but also our panelists. And we want to say that there's no one opinion or experience, one way of looking at this. Instead, we hope that our conversation today and hearing these multiple vantage points, that you're able to take from the presentation what's helpful to you and what's meaningful to you. And then our dialogue really models how you can, in your own congregation or your community, host conversations that engage different perspectives within the family, the communities you live in. So with that said, I'm going to move on here.